Should I limit iodine due to the Wolff-Chaikoff effect? Imagine your thyroid gland as a finely tuned machine that needs just the right amount of iodine to produce hormones. When you suddenly consume a large amount of iodine, your thyroid responds with a temporary slowdown called the Wolff-Chaikoff effect. This is a natural process where the thyroid reduces hormone production to prevent overproduction caused by excess iodine. In most healthy people, this effect lasts about 10 days, and then the thyroid escapes from this inhibition, resuming normal hormone production even if iodine intake remains high. Because of this self-regulation, most individuals with normal thyroid function do not need to limit iodine specifically to avoid this effect. However, if you have an existing thyroid disorder, such as Hashimoto's thyroiditis or Graves' disease, your thyroid may not escape from this inhibitory response properly. In these cases, excessive iodine intake can sometimes lead to hypothyroidism, which means your thyroid produces too little hormone. This can happen if the thyroid remains suppressed due to continued high iodine levels, especially after medical procedures like radioactive iodine treatment or thyroid surgery. Sources of high iodine exposure include iodinated contrast media used in medical imaging, certain medications like amiodarone, or very high dietary intake from iodine-rich foods such as seaweed, dairy, or iodized salt. For people with thyroid issues, it's important to be cautious with these sources. Consulting your healthcare provider is essential to determine how much iodine is safe for you. They might recommend monitoring your iodine intake or adjusting medications if needed. For those without thyroid problems, iodine is an essential nutrient that supports healthy thyroid function. Consuming iodine-rich foods in moderation is safe and beneficial. Limiting iodine unnecessarily could lead to deficiency, which also impairs thyroid health and hormone production. In summary, if your thyroid is functioning normally, you generally do not need to limit iodine to prevent the Wolff-Chaikoff effect. Your body naturally manages excess iodine by self-regulating. But if you have a thyroid disorder or have had thyroid treatment, working with your healthcare provider to manage your iodine intake is the best approach. They can help you find the right balance to keep your thyroid healthy and functioning well. Remember, personalized medical advice is always the safest way to address your specific needs.